Hello, I'm Dr. Curtis Crane.
And I'm Dr. Thomas Satterwhite.
Together, we have a practice here in the San Francisco Bay Area dedicated to serving the transgender community.
And we wanted to take a few moments to talk about our background, our practice, and why we're so excited to be taking care of the trans community.
Hope you enjoy it.
Dr. Crane, as many of you know, took over the practice of Dr. Brownstein, who had been a huge advocate for trans men, and he certainly expanded it to include all surgical options for both trans men and trans women.
For trans men, I offer chest masculizing surgery, liposuction, metoidioplasty, and free flat phalloplasty.
And then for trans women, all surgical procedures, facial feminization surgery, breast augmentation, vaginoplasty, and then for all individuals, any aspects of cosmetic and aesthetic surgery.
My first exposure to the community was actually overseas. One of my trips was to Belgrade, Serbia, working with Dr. Djordjevic, and that's where I had my first exposure to surgery for the trans community.
When I was a resident, I had met Dr. Don Laub. Speaking with him made me realize, the great work that he was doing. And that, I think, for me had been a spark.
The more I discussed how fascinating the surgery was, the more I actually saw how much of a bias there was against this community.
I've always wanted to work with an underserved community, and I think I found the community that's the most underserved. I think for far too long, the trans community had been taken advantage of. There were way too many surgeons, doctors who were performing procedures and operations and weren't qualified to do that. So I felt that it was important to do that fellowship in craniofacial surgery and be as well trained as possible before taking care of the trans community.
I truly developed my own residency/fellowships in reconstructive urology, plastic surgery, and specifically transgender surgery, so I could offer the best that I possibly could to my patients. For me, the next step in trans care was not only piecing together my own training program, but pushing the envelope, getting third-party payers to start taking responsibility. Far too long, you had patients that were paying into insurance premiums that weren't taking care of the surgeries that they needed. That movement wasn't going to push forward until there were surgeons and doctors saying, no, I will work with any insurance company. Now the nidus is on you.
With our practice, everyone here is dedicated to working with patients, to making sure that they're getting the appropriate coverage. No one should have to face the burden of spending $30,000, $40,000, $50,000, $100,000 for an operation that's medically necessary.
At this point, I believe my practice is treating about 90% insurance patients.
One patient that we took care of is actually an identical twin. We're both assigned, girls, but he's a transgender boy getting top surgery, about 14 years old. The operation went wonderfully well. He came back, and then I took off the binder and took off the dressings, and then mom started crying, and then dad started crying, and then sister started crying, the patient started crying, and then I started crying, and they were all like hugging and crying. It just really reminded me of why I'm doing the work that I'm doing.
I really enjoyed the first orgasm texts. Dr. Crane, I know you said not to try for 8 weeks, but I thought 5 weeks was pretty close to 8 weeks, and I just want to let you know I had my first orgasm and everything's awesome and it's incredible. Thank you so much. Sometimes I get those texts at 2 in the morning. You can wait until 8 in the morning, but anytime I get those texts, of course, I'm happy for the patients that are enjoying their new genital reconstruction. Taking it for a test drive. If you'd like to contact us or find out more about our practice, please visit our website.
And thanks for watching. We're incredibly honored to be of service to the trans community.
Let us know if we can help.
Hi.
Do you have a feather boa or something? Like,
well, no, I'm just on Tuesdays. But...
Okay, first of all, it is Tuesday. Second of all...
Oh, it is. I didn't realize.
Got a point. I accept you, Thomas.
Like
I accept you for who you are.
Gay.
Why don't I go, this is my gay colleague.
Hi, I'm gay.
I'm just kidding. I know who you should see. It's not us. And finally I'd hear Jen exclaim, "Oh, you're a natal male!" That might not be a very funny story.
And they're all like hugging and crying. And
Because they were happy?
Yeah.
You cry every day.
Yeah, that's true, because
No,
we're
he doesn't
farting.
cry.
We're incredibly honored to be taking care and of service to the
I wasn't supposed to say my name. I'm just supposed to say I am.
Yeah.
Because my name isn't doctor. That's crazy.
I am. Just
It's funny how hard talking can be. Yeah, how do we look right now?
A little closer. A little closer. Closer. You're actually...
each other.
Just for a second, just for the blooper reel. Slanted looks.
On, or should it be like to the side, or
From the back. Hurt my hand.
Much touching in this relationship.
Yeah, there's a lot.
Help it. I wish there were more.
Wow.
I'm just kidding.
You want that to go on the blooper reel?
No. Oh, yeah.
Okay.
Leave that out.